Hey YouTube, it's Casey here with another update. I don't really have a format for this video, so maybe a little all over the place, so just kind of bear with me as I kind of muddle through my string of thoughts. So I'm making this update video because almost 2 weeks ago now I've had a hysterectomy, so I just wanted to talk a little bit about that. I've mentioned in past videos how I am taking testosterone right now, but it's not something that I want to be on forever. And so I've been trying to figure out, what I can do about that. And as it turns out, hysterectomies can be kind of like pick and choose your organs in terms of what you take out. And so with my particular hysterectomy, I opted to leave in my ovaries. And so what this means for me is that at some point in time in the future, when I eventually decide that I have achieved all that I want to with testosterone, I'll be able to go off it without needing any sort of hormone any sort of hormonal that's the word I'm thinking of any sort of hormonal supplements. So because I've kept my ovaries, I can go off testosterone and I wouldn't need to worry about taking estrogen or testosterone because my ovaries will continue to function as they should, hopefully, unless something happens to them. But I've gotten most out of what I want out of testosterone at this point in time. I might continue to take it for a couple more years, just to try and fill in some of these patchy spots that I've got hair-wise, which I'll talk about in another video. I want to do another testosterone update video. A little late, but, better late than never. But I do want to try and fill in some spots that I've got patchy with hair, so I think I may stay on testosterone for maybe like a couple more years. But now I do have the option to be able to go off it when I want it to. I had not been planning on having a hysterectomy quite so soon, because I want to stay on testosterone for a couple more years. But unfortunately, or fortunately, depending upon how you look at it, it just worked out for me right now to be able to get it done. I was able to get it done with a surgeon who is an OBGYN who works specifically with her hospital to try and make sure that it's LGBT friendly, and she specifically works with transgender patients. She's done a lot of surgeries, like hysterectomies and stuff, for trans folks. And she was recommended to me by the doctors that I see who work in an LGBT primary care center. So I was really happy with her, being able to go with her, and the way that my work is right now, I was able to take some time off and go home to recover and have family help take care of me. So the timing just worked out for me right now. And with my health insurance, it worked out well, especially considering I'm probably going to be losing my health insurance pretty soon. But that is another topic for another time. So I had my surgery on Friday the 13th of December, and I did do it out of town and then ended up traveling afterwards. So I stayed in a hotel in the city where I had surgery, and because it was Friday, I got in Thursday evening, and then Friday morning was surgery, and I had surgery. I had to be there at 10, so I think surgery was probably like 11:30. They never really told me the exact time for surgery, just what time to show up. And then after I woke up, I stayed in the hospital for a few hours. They wanted to make sure that I was able to eat and drink and go to the bathroom fine before they released me. And then I went back to the hotel where I was staying, and I stayed there Saturday, and then Sunday afternoon I had about a 3.5 hour drive to get back to my family's house where I was going to be staying. And I just, I wasn't driving. A family member that I took up with me drove down, and we would stop every hour or so, and I'd just get out and walk around to make sure the blood was circulating and there'd be no blood clots or anything like that. 2 weeks out, I'm feeling pretty good. I was given the, brand name or whatever of like Tylenol and Motrin to take. So I've been taking that, and they gave me oxycodone to take like as needed. In addition, Colace, which is a stool softener, to take with the uh, oxys because they can tend to, um, mess with your bowels. And today is now the third day of being completely off all the medicine. I was only taking the oxycodone as needed, so I would take it usually in the morning when I woke up and then at night before I went to bed. And I did that for about a week or so. And then for a couple of days, I would just take it before I went to bed. And then a couple, and I was taking the Tylenol and the Motrin were every 6 hours for each one of them. And I was taking them both at the same time, so I'd kind of stagger it. So I take, say, if I woke up at 9, I would take one of them, and then 3 hours later, I would take the other one. So every 3 hours, I was taking a pill, but like staggering it so that, I was taking both of them at the same time. And so I kind of weaned myself off of those where I was only doing, like, instead of having both of them at the same time, I just do one of them at the same time. And then eventually I was just taking one when I woke up and I went to bed. And then there were a couple days where I just took it before I went to bed, and then I just like stopped taking it. So now I'm not on anything, and I'm feeling pretty all right. Like, I've spent a lot of time on the couch, and I've had people help, prepare meals for me, and I've been walking around the house. I've been out of the house kind of like 3 times now, but once was to walk to the neighbors, so I don't really know if that counts, but 2 car rides. And for the first car ride was exactly a week after surgery. I went to the movies, and so I took a little extra pain medicine that day. I had been not taking the oxycodone by that point, but I took one to go to the movies, which helped out a lot on the roads. And I went out today. I just took a little car ride down the hill, maybe like a 15-20 minute car ride. And I didn't take anything before I went in the car, and it was like a little bit rough. I felt all the bumps and cracks in the roads. It's winter time, so the roads are a little crackety right now. So it didn't feel like super great, and I just kind of sat in the car and I went back home and I went to the couch for the rest of the day. And I think, if I end up going again within the next week or so, I'll probably take like a Tylenol or a Motrin before I get in the car, because it was a little rough. It felt a little bit like being punched in the stomach, but like not awful, but like it didn't feel good. And I always err on the side of caution after I've had a surgery and healing up. Like, I really want to make sure I give my body the time to like really heal properly. And with the surgery that I had with they gotta kind of push and poke around your organs a little bit. So there's not like any big incisions like top surgery, but there are like, I did it laparoscopically, so there's 4 holes in my abdomen where they just kind of cut through your skin and your fat and then your muscle to get inside, and they gotta push around your bladder and some other things to get to the uterus to get everything out. So it's a little tender in there. It's tender in that area, and I mean it's inside me. I can't really tell what's tender, like in terms of bits and pieces and organs and whatnot. But it's like still a little bit sore, but not so much I need to take anything anymore unless I get in the car, as I learned today. But otherwise, I've had this is my third surgery that I've had. Uh, about 2.5 years ago, I had top surgery. 2.5 years before that, I had surgery on my ankle. And out of all 3 surgeries, I think that the recovery for this one has been the easiest. That said, it's still surgery, so I'm still like taking it easy and being careful. It doesn't feel like super great. Sleeping is always uncomfortable. I've been sleeping on my back just to make sure. Like, I can sometimes toss and turn a lot, and I tend to sleep like either on my side or on my stomach. So I've been trying to avoid that and sleep on my back. So it's been not great on my back. It's a little bit sore, but I think it's probably better for my organs and whatnot to heal up. And I'm pretty happy with my decision. I have never wanted to have children, so that was not even a concern for me. And the biggest thing was, like, if I stopped testosterone, I did not want to have to deal with my menstrual cycle again. So this was the best option for me to be able to do that. And I'm pretty happy with my results so far. I have a 2 week and a 6 week checkup with my surgeon, so we'll have to drive up there, and I'm still gonna take some extra time off of work to recover. I think I'm taking like 6 or 8 weeks just to really make sure that everything is healed up properly. Even though I think, by next week I'll probably be fine, but I wanted to make extra certain the type of work I do can sometimes get a little physical, or, have to be worried about getting assaulted or something like that. So I tend to take a little extra time for healing. But things are going pretty well. I'm happy with my decision to do this. It did happen a lot faster than I would have liked. Initially, I knew that my health insurance is probably going to be ending at the end of this year, a couple days. And like I said, I've been recommended this surgeon by some doctors that I see. And so I initially just went to have a consult so that I could kind of learn a little bit more about hysterectomy. So in the future, a couple years down the line, when I thought I would be able to get one, I would be a little bit more well informed. And so I had my consultation with the surgeon, and things were going well. And I did let her know, I'm not planning on doing this anytime soon because my insurance is running out. And she actually told me, and I had the consultation 3 months ago, and she told me that she actually had 2 days open in December that she could sneak me in, right before I lost my health insurance, and to let her know in like 2 or 3 days what I wanted to do. And so I didn't really have a whole lot of time to think about it, but I thought it'd be the best decision to get it right now. So it did feel like a little bit rushed because I made that decision really quickly because I needed to secure the date to make sure nobody else took it. So it's a lot different from my top surgery in that way. For with top surgery, it was something that I had been researching on and off for about a decade. Honestly, it was about 10 years or so, maybe a little bit longer. Versus this one, I just had like a couple days to decide, and then once I decided, I had about 3 months to do all of my research for it and everything. And I always, always, always over research everything that I'm doing with like anything in life. I overanalyze. And so I was definitely prepared for the surgery, but I didn't feel like I was as prepared as I could have been, even though I was definitely more prepared than I'm sure a lot of. I think I might have looked into it more than like some other people probably do for this type of surgery, but that's just the kind of person I am. So like going into it, I felt like I wasn't quite ready for it, but it is something that I'm glad I've done, and I don't know how much more like I could have learned about it beforehand, other than just like agonizing over it in my head for like years, like I did with top surgery. So it definitely was the right decision for me to do. It was just a little bit faster than I thought. Like I mentioned once or twice, it wasn't a surgery I was expecting to have for another couple of years if I had it at all. But it will be the right thing for me because I don't want to be on hormones forever. Like, it's really wonderful that some people want to do that and they're able to do that. And you have like permanent and temporary changes with hormones, and you also have like physical and mental changes with hormones. But for me, like, I don't get a lot out of it mentally. It's mostly just the physical aspects that have changed for me. And so now that all of the physical aspects, except for the hair that I talked about, have changed, like, there's not really a whole lot of reason for me to continue it for much longer. And so eventually, once I get hopefully a little bit more hair growth in a couple of years, I'll be able to stop and, like, it should be fine because I won't have any of the mental changes that some people do get with hormones. So I should be able to stop. Obviously under a doctor's supervision. But I think that's about it. I did, like I said, I did it laparoscopically, so I've got like 4 very small incisions. Uh, they're probably like a little bit larger than the 2 drain holes that I had for top surgery. I still have the steri strips over them. I'll probably take them off shortly. Um, I've been also very careful showering because I don't want to get like water spraying directly onto them or anything like that. And luckily, I like the detachable shower head, so I can kind of wash around them. But I think I'll be taking off the steri strips shortly. And there are some dissolvable sutures as well that were used to close where the laparoscopic incisions were made, but they're, as the surgeon described, 5 millimeters large. So I think they're like maybe about that long, maybe a little bit longer. And there's one in my belly button, and then 3 below that, kind of one on the right side and 2 on the left side. And I think they'll heal up pretty well. But I think that's about it. I just wanted to talk about the hysterectomy a little bit. I've got plans for another video that I will actually structure out, so it's not just kind of this random rambling. But that's all for now, and I guess stay tuned. If I have any major updates with the hysterectomy, I'll be sure to make another video about it, possibly after I've had the follow-ups with my surgeon. But as always, if anybody sees this and has questions, feel free to reach out. Until then, bye.